Hi everyone, this is Alex from Salmonella Plays. Today's pharmacology lecture is going to be on anti-epileptics. So what is epilepsy? This is an electrical hyperactivity of the brain cells which causes seizures. It's when all the neurons fire at once and it causes a motor and sensory disorder. There are two types of epilepsy, primary and secondary. Primary epilepsy is idiopathic. That means it happens and doctors aren't sure of the exact cause. Secondary epilepsy is due to infection, trauma, or a neurodegenerative disease. Seizures can be focal, which have a simple or complex form, generalized, which are made into two subgroups, including absent seizures, which are non-compulsive, therefore the patient is not aware while the seizure is going on, and tonic-clonic, which are compulsive seizures. There is also a third type called status epilepticus, which is repeated seizures over and over, and it causes one big prolonged seizure, which lasts for more than 30 minutes. Now let's go on to the first group of drugs. These treat partial and tonic-clonic seizures. Phenytoin and fosphenytoin inhibit the sodium channels, so they're antiarrhythmic. They are selective blockers which can be given per os or through IV. Phenytoin binds to the inactive channels and decreases the neuron discharge rate. They have a higher effect in most active parts of the brain by decreasing the neuronal activity and increasing the refractory period. This means that this drug has use dependence. These drugs do interact with contraceptives because they are enzyme inducers, so they increase the metabolism of these drugs. So if you are taking birth control, that's something important to know. Their side effects include headache, dizziness, ataxia, GI problems, and gingival hyperplasia. Carbamazepine is also used. However, it does cause sedation, water retention, and trigeminal neuralgia. Phenobarbital is a long-acting barbiturate and can stay in the body for up to 4 days. It's a positive allosteric modulator used with GABA receptors and an enzyme inducer. Its side effects include sedation, respiratory depression if overdosed, and it is teratogenic when given by IV. Now on to group 2, which treats absent seizures or sudden short blackouts. Ethosuximide inhibits T-type calcium channels. It's given orally and there are no side effects. Trimethadione, however, does have serious side effects, and that's why it's not really used anymore. And the last group, or the broad spectrum anti-epileptics, these treat both partial and tonic-clonic seizures as well as absent seizures and the status epilepticus. So the first drug is valproic acid. This inhibits both sodium channels and T-type calcium channels. It also increases the GABA levels. It's given per os and it's a displacing agent. It also causes enzyme inhibition. It can also be used to treat acute mania and as a migraine prophylaxis. Its side effects include GI disturbances, sedation, tremor, and allergic hepatotoxicity. Diazepam, nitrazepam, and clonazepam work like barbiturates. They increase the GABA levels. Diazepam especially can be given in an IV to treat status epilepticus, and the side effect of these two drugs are sedation. Lamotrigine is also used, but not that frequently. And finally, to treat status epilepticus, we would give the following 3 drugs in these dosages. Diazepam, 10 milligrams, followed by phenytoin, 250 milligrams, followed by phenobarbital, 100 milligrams. Thanks, guys. I hope you found this useful. Check out my pharmacology playlist on salmonellaplace.com for more pharmacology lectures.